You start to lunge and try to pick balls or shuttles. That's when you tear your Achilles. So again, stretches become so important. And the other injury, especially in older individual with racket sport, is the shoulder muscle tear, the rotator cuff. Running per se is probably the least injurious sport in my opinion compared to other racket sports. Football injuries, shoulder muscle injuries, tendon injuries, due to racket sports, they are far more likely to need surgical intervention. I have different shoes for different patterns, so I can't answer that question with one set of shoes. So somebody will have to try multiple shoes to figure out what suits them the best and the kind of distance that they are running, kind of pace they want to run. Generally speaking, from a medical perspective, a cushioned shoe goes a long way to protect you from stress injuries.
Welcome to this special episode of the RunPlayGo Podcast. I'm Shivani Singh, and our guest today is Dr. Jayant Arora, a renowned joint replacement surgeon with over 2 decades of experience. He's the director and head of unit at the Department of Joint Replacement and Orthopedics at Fortis Memorial Research Institute, Gurgaon, and also leads the Gurgaon Knee and Shoulder Clinic. Dr. Jayant Arora is trained in UK and has pioneered the use of advanced techniques in knee and shoulder surgeries, including robotic-assisted knee replacement and patient-specific instrumentation. He's also an avid runner and cyclist, bringing a personal understanding of sports injuries into his medical practice. What we can expect to learn today is how runners can prevent injuries, understand early warning signs, and approach recovery with the right medical insight. Deep dive into the science of running mechanics, common myths about injuries, and knowing when to see a specialist. Let's go. Also on this point, when is the right time to stop the conservative treatments? I would call physiotherapy conservative, and actually go into slightly more specialized, where I know that maybe I need, surgery. Once I come to you, for example, you'll go through the tests and you'll tell me what's the next step, right? But what's the right time to stop that? Because even that, myself and some other people I know, go through a very long period of extended physiotherapy, for example. But when you say that, okay, this is enough, now it's time to move to the next step.
There are a lot of other sports where people tear ligaments in the knees and they need surgery straight away. And I just do it left, right and center every day. I see them on day one and say, okay, you need a surgery, you can't go back and play. But that's for football. People busting their knee ligaments, meniscuses and other things.
It's a more high impact.
What I'm trying to point out here, specifically for runners, is that thankfully there are very few injuries which need surgical intervention. There are times when it might need rest, certain specialized medicine, sometimes injections around the muscles and tendons, but sometimes surgeries as well. But not that common. Football injuries, shoulder muscle injuries, tendon injuries, due to racket sports, they are far more likely to need surgical intervention than running injuries.
Actually, on that point, I'm reminded that pickleball is the new emerging sport.
Correct.
And the best part about that sport is the access. By access, what I mean is that a 10-year-old kid vis-a-vis an 80-year-old person can play because of the speed and the accessibility of smaller court and things like that, right? So now we're also seeing many more injuries suddenly popping up in pickleball players because it appears to be much simpler than it actually is. It still is a racquetball sport, and somebody who's never played a racquetball sport before might actually have sudden impact injuries.
Correct.
So that's another area which
absolutely. So typically racket sport injuries will give you, which are serious injuries to your Achilles tendon, the heel cord. Badminton players get it all the time. If they snap it, it straight away needs a surgery. And if you have never played a racket sport, you start to lunge and try to pick balls or shuttles. That's when you tear your Achilles. So again, stretches become so important. And the other injury, especially in older individual with racket sport, is the shoulder muscle tear, the rotator cuff. So there are muscles in the shoulder called rotator cuff, and they can become torn with racket sports, and they can be pretty painful. And very often they need surgical repair. Running per se is probably the least injurious sport in my opinion compared to other racket sports.
That's the most interesting part, because most of the times when we are talking to our non-running friends, the one thing that always comes back is that, hey, but running is really bad for your knees. Why? How can you continue it for years and years and years? So aren't you concerned about your knee health or your your bone health?
There's no bigger myth than that.
Yes.
Yeah. Okay. That's,
and I wanted you to bust that.
So that's the biggest myth, and I've been trying to counter that myth every time I see somebody, mentioning about that. So on the contrary, running in moderation is the best thing that you can do to protect your knees.
Correct.
Even if somebody has been diagnosed with mild or moderate arthritis in the knees, they're still amenable to run. They can start with a brisk walk and then take up a light jog, and their knees should do just fine. In fact, more sedentary life is the worst thing that you could do to your knees. If
Correct.
you keep on moving, your knees remain protected. So it's a complete myth.
Absolutely. It sounds so counterintuitive, right?
Yes.
That if I already have a problem in my knee, how could I be putting more pressure on that? I know so many people who suddenly gone off sports completely and they've gone into different kind of mobility, but they have left that. What you're saying is actually quite interesting.
In arthritis, the damage is happening to the structure called cartilage, which is the cushion in the knee.
Yeah.
And this cushion has no blood supply. This cushion has no nerve supply. So the only nutrition it gets is from the fluid of the joint.
Yes.
Okay. And when we are moving, we essentially are giving nutrition to the joint.
Right.
So light jog, not a brisk run, not a very heavy impact activity, a light jog or a brisk walk or a swim or a cycle, anything which moves your knee, if you have arthritis, goes a long way to nourish your cartilage which is getting damaged. Fantastic. And that's how you protect it.
Wow.
And on top of that, just by being active, you tend to lose weight, which is the best thing that anybody who has arthritis can do to protect your knees even further.
Yes, less weight on the joints. Yeah.
So being active, losing weight, having strong muscles, and nourishing your cartilage by gentle movements is the answer.
In this, do collagen supplements come in the picture somewhere? Because that's a big buzzword, right?
Yes.
In our supplementation chain now, that's also been added.
Yeah, I do use them in my practice as well. The scientific data is not very robust, by the way. It isn't really, a very solid line that, okay, yes, they make a tremendous difference.
Correct.
But they do make some difference, clearly.
Okay.
And especially in the early stages, not in the late stages, but in the early stages of knee arthritis or knee wear out, mild or moderate levels, collagen supplements generally tend to improve symptoms.
So it's a great idea to add it to your line of supplementation that as athletes we consume on an everyday basis, some bit of it?
I probably won't recommend it as a general supplement for an athlete, but I'll probably recommend it to somebody who has a knee issue, who wants to remain active and who's running and who's enduring the knees. Then I would ask them to try it out, and if it helps them, then yes, they can continue it for a long term.
So it's not a preventing measure, but it's only when
you have some symptoms.
As someone who's into pioneering robotic and so many patient specific newer interventions, what are how do you think these innovations have helped now resolving some of the treatment outcomes for the runners?
So I think the robotic surgery at present is mainly addressing the issues that people in older age group face, which is people in their 60s and 70s and 80s, where they have established knee issues.
Right.
Okay. In very few younger individuals, we do find arthritis affecting their knees. In those people, we can potentially do robotic partial sort of type of surgeries, not a full replacement, but a partial replacement, and allowing them to remain fairly active. Right. So people who have arthritis in their 50s, there are a lot of it, by the way, which you and me don't come across as runners, but I do come across them in my workplace.
Practice.
So those 50-year-olds who have arthritis, which is stopping them from physical activity
or some sport or whatever
they can be treated. Some of them can be treated by a partial knee replacement, and they can resume fairly active life, including playing racket sports, running, swimming, cycling, and they can suddenly, it can be life-changing thing for them. But generally speaking, robotic surgeries are more for older age groups and not for sports injury treatment.
Understood. But as someone who's seen the sports cycle evolution in the country over the last 20-30 years, again I'm coming back to pickleball. I think this is going to change a lot of things. Even in your, probably the kind of patients that you will start seeing now, as more and more number of people will start playing pickleball, and like I said, that they've not been exposed to any active sport before that. That's the specific demographic we are seeing emerging. So I think this 50 plus playing sport for the first time, playing an active sport for the first time, and getting into situations like what you just mentioned, might have a role to play there.
The best advice for somebody in their 50s who's starting out with any sport is to of course go for it, don't stop, but take due precautions, stretch yourself, take a little bit of training, and don't be very aggressive, don't be very competitive.
Correct.
You might not be your 30-year-old self. You might become a 30-year-old self, by the way, after 2-3 years of playing.
Absolutely.
But don't try and behave like as if you're 30-year-old on second day of racket sport, because that's when you can injure yourself. Yes.
But tell me, this question is just coming to my mind now that we spoke earlier about probably going through some screening or clearing before we get into any active sport. So now coming back to the pickleball part as well, and a lot of them are now older players, because that's what the sport allows you to do. Do you recommend, especially given arthritis background and some others, that there should be some basic screening that they might want to go through before they get into playing aggressively?
So look, if somebody hasn't been active at all, then yes, the answer is yes, they should get a basic screening done with a physician, with a cardiologist, and maybe if they have any worries about their joints, maybe with an orthopedic surgeon also. But much more important than their joints, it's their heart. In a 50-year-old male person who has been working throughout their lives in the office, maybe using smoking and alcohol on a heavier basis, those are times when we really want to check up your heart before you get into really strenuous sport after 50. I think that's one thing we should definitely check.
Got it. So just a quick round of very quick questions. What's the best shoe for injury prevention in your mind?
It's variable for an individual like me, and I'm just a very small runner. I mean, I run, but I don't consider myself a runner. I just do it as a stress buster.
You just go and run marathons, just for.
So even for somebody like me, I have different shoes for different patterns.
Days,
so I can't answer that question with one set of shoes. So somebody will have to try multiple shoes to figure out what suits them the best and the kind of distance that they are running, kind of pace they want to run. So, but generally speaking, from a medical perspective, a cushioned shoe goes a long way to protect you from stress injuries. I'm not a big fan of minimalistic shoes, by the way.
Correct. In fact, that's something that I wanted to come to later, but you've already answered that. And the reason for that is the lack of support for your arches.
Yes. So not only lack of support, you need a bit of the drop. The heel should be high. The front part of the foot should be a little low. So that drop protects your Achilles. That you then protect yourself from injuries to your heel cord. If you have a very cushioned shoe, then you prevent yourself from getting so-called plantar fascia pain, the pain in the heel.
Correct.
You also protect yourself from getting pain on the inner side of the foot. So a lot of ankle and knee injuries can get minimized, if not fully prevented, by a good cushioned shoe. So if you see most of the training shoes, even for professional players, they are not carbon plated shoes.
Absolutely.
They're all very well cushioned shoes.
So many injuries could be prevented if we were to know a little better about the carbon plated shoes. And we all have gone through the cycle. All the big brands suddenly launch these, all the the newer models are with carbon plated, right?
Yes.
And we pick them up and then we are doing training runs in them.
Correct.
And we've gone through that cycle of learning.
Yes.
That the impact in that for everyday runs is too high.
Too high. Yes. So they shouldn't be your daily practice run shoes, clearly. Yes. They should be your race day shoes, maybe.
Absolutely. And so which basically means no Vibrams.
Correct. I mean, personally speaking, I would stay away from Vibrams because your risk of injury will go high. I'm not aware of any studies which has compared with these kind of shoes.
Correct.
But my suspicion is that you will have a high risk of injuries. And
then there is barefoot running.
Well, again, much higher chances of injuries. Not only because of injuries to muscles and tendons, but also because landing on a pebble or something.
Another topic which is of great interest to the runners is taping. Before any big run, if I have a little bit of concern or softness somewhere, we routinely tape that area and then we go for a run. If my ankle is a little soft, I'll just tape it up nicely, and specifically on the race days. So what's your opinion on that?
Taping is useful in very specific instances. At best, it will give you moral support. by the way.
It's all in the mind.
Correct. So that's one part of it. But I don't want to say that taping is completely useless in every situation. Taping done by a professional physiotherapist who exactly knows that by taping what muscle they are trying to offload in that particular individual, that can be of some use. Okay. That can reduce the pain on the race day. But taping in general on the painful area without knowing how to put it, where to put it, is more of a moral support, nothing else. That's like putting a kneecap on. A lot of people run with kneecaps as well. No use, in my opinion.
What about ice baths? That's a new buzzword, right?
Yes.
So many products in the market, and it's a new science which has kind of evolved.
Yes.
We all knew that icing is great for you, but ice baths is like, after every run as a recovery.
The ice baths work by letting the accumulated lactic acid in the blood getting back inside the muscles. That's how the ice baths work. It just reduces muscle soreness, reduces muscle cramping, and to some extent it might fasten the recovery. It is used by professional players. Our Indian cricket team uses it.
Which is where it has come now to recreational athletes as well.
Correct. Our Indian cricket team uses it. For example, I've seen quite a few pictures and videos of them taking a dip in the ice bath.
What's one injury that you've seen frequently being misdiagnosed or mistreated?
The most important injury that I've seen people sort of sticking to and keep on struggling with and not getting better is stress fractures. Okay, people have cracked the bone and they're being treated for a pulled ligament or a pulled muscle or a sore muscle or something like that. So that's something which sometimes get missed, and it gets missed because it's not easy to pick it up on an X-ray or an ultrasound. It often requires an MRI and a suspicion that it's not getting better. Is it something more? And of course a careful clinical examination as well. I wouldn't suspect a stress fracture on day one, but I would suspect a stress fracture in the 4th week or 6th week if somebody is not getting better. So sometimes the duration of the time, somebody has gone through with the pain, and on examination, and if the treatments haven't helped, then it'll ring my alarm bells that is it something deeper?
What's one treatment practice that's still being followed, although it's completely outdated now?
I still find people using hot packs. If a running injury has happened due to inflammation of muscles, heating it can cause worsening of inflammation.
You're absolutely right, because even in our protocol, so many times what we do is there is this intervention of heat followed by cold. And repeating that multiple times. Even I followed that many a times.
Generally limb pains, joint pains, knee, ankle, foot, wrist, elbow, shoulder, joints. These pains are generally inflammatory due to inflammation.
Correct.
And icing these areas is preferable. A neck and back pain could be muscle spasm due to wrong posture or some muscle pull, and there one can still go for a hot pack.
Oh, that's a good rule then.
Yeah.
And how do different surfaces like road and trail and track, etc., they influence long-term joint health?
Another myth that I've seen people is that running on a treadmill is worse than running on the road. It's actually not. It's boring, I agree.
It feels harder.
Yes.
Feels longer.
Yes, but it's not harmful for your knees, and definitely not harmful than road running, because treadmill surface is usually softer. So somebody who is running on a treadmill that doesn't want to run on a road because of weather or because of traffic or whatever else, treadmill running is completely safe. The only trouble that I do see people on treadmill is that if they are running long distances at one constant pace, then they can potentially induce muscle injuries because they are running at just one pace, because treadmill makes them run at one pace. They do not vary their pace. So that's one problem with the long distance. But otherwise it's completely safe for your knees and joints. Trail running has higher risk of injuries because you land awkwardly. You are more likely to twist your ligaments and ankles, or even the knee, because you're landing in a different uneven area. It's harder. So I think trail running is probably more dangerous, more injury prone sport.
But let's say from a long-term health point of view, so if I'm somebody who does training on a trail on a regular basis, so does that, and this is a very novice question, does that make me more prone to injuries faster from a wear and tear point of view vis-a-vis somebody who's, let's say, training only on the track?
Possibly yes, because if on trail you are sustaining multiple minor small injuries to your ankle and feet over a period of many years, 15 years, 20 years, they might accumulate and lead to some sort of a long-term injury. For example, professional footballers, they go through those grueling set of period from age of 18-20 till 35-40 when they retire, and in these 20-year period they train like crazy. They are into multiple injuries, and their knees take a lot of brunt, and eventually by the time these are 40, 45, 50, they have pretty bad knees, by the way.
It's worn out.
That's worn
with
out
all the
because of the
impact.
multiple injuries that they've gone through. So trail running potentially can lead to multiple smaller twists, which a runner would, let it heal and then go back to running on trail again. So over a period of long time, these small injuries can accumulate and lead on to arthritis. Running on the road is not going to do that, because then you don't twist your ankle by running on the road.
What about the wearable technology? Is it more of a trend, or does it actually has a role to play in terms of injury prevention and recovery for us? We all wake up and we say, or after a run we say, hey, I've got 64 hours of recovery, and we make fun of it, honestly. Because after every run it gives you 40 hours, 30 hours. Is it really that cleanly linked with what's really going on within our bodies?
I won't say wearable technology has a very sort of major indicative role in how long you should give it a break and recover period. I think what it does is that it gives you objective data set so that you can compare your inner feeling with that data, and everybody will have a different inner feeling for that particular data. Somebody is doing a sprint, will know how they feel when their heart rate reaches to 180, and how would you feel when you are at 191. Okay, if you feel at 192 or 195, I'm going to pass out, you don't want to go there. And similarly, there would be people who might say, okay, I can go to 200 and I'm okay, when I'm sprinting. For everyone, those wearable technologies are giving you objective data points to match with your so-called feeling, the feel factor, and you can use that feel factor to then guide yourself.
So it's your range. Basically, it tells you about your range, and within that range, how at different points you feel, and how much more fuel you have in your body to go past that and sustain.
Yes. If you really want to use the wearable data, then look at your HRV actual data, see what's the average level of HRV that you have, and if it is lower than normal, then you need a longer recovery time.
What are your top 3 tips that every runner should have to have a long injury-free running career?
Consistency, listening to your body, and regular stretches.
So where can somebody, on that note, come and see an expert like yourself, when we are in that zone and when we are looking for advice? When and where, and would you like to share some coordinates?
So I'm practically every day at Fortis, Monday to Saturday. That's where you can find me.
Thank you so much, Jayant.
Thank you.
And it was a pleasure to have you with us.
Same here.